everyone, welcome to the lecture of the digestive system and its structure and function with the major organs. So to kick things off, I want to put in perspective how long your digestive tract is. It is also called the alimentary canal, but it is roughly 8 meters long. So over this past weekend, you had the assignment to go and find things that were the size of different parts of your digestive system. To put in perspective, 8 meters is larger than a giraffe and taller than a Tyrannosaurus Rex. T-Rexes were only 7 meters, giraffes are only 6 meters, so 8 meters, that's roughly another 3 feet added onto a T-Rex, and that's all shoved within your body. Now, of course, if you are a taller person, then you're probably going to have a longer digestive tract. If you're a shorter person, you're going to have a shorter digestive tract. So that 8 meters is a good rough estimate for the average human. So let's start talking about the mouth. The mouth is where food originally is going to go, and this is where chemical and mechanical digestion begin. So you have a couple of different things within your mouth that allow for these digestions to occur. First of all, the tongue. This is what helps push food around underneath your teeth so that you can mechanically break down the food into smaller pieces and help with the dissolving process. We also have that hyoid bone back here, which we talked about with strangulation, and that is what attaches the tongue to your mouth. You also have like a little frenulum underneath, which is going to help lock it into place so you don't swallow your tongue, and it helps you detect what foods are good for you and bad for you by having the taste buds. If something tastes really bad, chances are it's not good for you to eat it. That's one of the best reasons why we have the sense of smell and taste. If you have a carton of milk in your fridge and you're not quite sure if it's good or not, you should smell it first. And then if you can't smell any difference, hopefully the tongue with its taste buds will pick up on any type of sourness within the milk so that you don't actually put that into the rest of your digestive system. On the opposite side of the tongue, on the top, we have the palate. Now, the palate has 2 portions. We have the hard palate, which if you press your tongue up to the top of your mouth, you'll feel it's like that hard bone, and that's going to be at the front of your mouth. But as you move your tongue back, you'll feel the bone stop, and then it's going to be kind of squishy in the back, and that's where the uvula is going to be found. Now, this soft palate is there to close off the nasal cavity when you swallow, so that way you don't get as much air down into your digestive system. That hard palate is a great trait for mammals. Mammals have a separation between the nasal cavity and the mouth because when we are infants, we breastfeed. And so it's really important that we can feed at the same time as we are breathing. So, teeth. Another big player when it comes to digestion, mechanical digestion in your mouth. You have 2 sets as a mammal. You have a primary set, which is going to be lost when you're a child. And then eventually you're going to get your secondary set, and then that's going to stick with you for the rest of your life. So treat them well and don't do drugs. The function of them is to begin mechanical digestion. We're going to start breaking down that food so that way it can be dissolved easier during chemical digestion later on. A tooth has many different portions to it. We have the crown, which is going to be up at the top. We have the root, which is underneath the gums. We have the dentin. The pulp is where all of the blood and nerve endings are. So if you're having a lot of sensitivity with your teeth, chances are the crown or this top portion is starting to wear away and it's getting a little bit closer to the dentin and to the pulp. We find this really interesting divide between dentists and doctors. A lot of doctors, they still know quite a bit about teeth, but they don't specialize in this. And dentists are doctors as well, but they don't specialize in like circulatory system or respiratory as much. And so we're starting to see more dentists and like medical practicing doctors working together because turns out that your health of your teeth is also really beneficial for your health for the body in the long run. Salivary glands. This is what's going to help moisten the food. It's going to bind the food together so that way you don't have like a lot of debris and just kind of like floating around chunks. And this is what's going to eventually make something called a bolus. Now, Within your saliva, it's going to have a little bit of like a watery solution, a thicker solution, which is mucosal. And then we also have an enzyme found there called amylase, which is going to help the digestion of carbohydrates begin. Carbohydrates are some of the main sources of energy, or it is the main source of energy for us. And so the sooner we can start breaking down the carbohydrates, the easier it is for us to absorb it later on within the small intestines. So the pharynx, we've seen this before. The pharynx is the back of the nose, mouth, and throat. We have three divisions of it. We have the nasopharynx, which is posterior to the nasal cavity, the oropharynx, which is posterior to the mouth, and we also have the hypopharynx, or the laryngopharynx, which is going to be right behind the larynx itself. Now, because all of this is open for both the respiratory and the digestive system, the larynx is an organ or a space within both systems. So I want to make sure that you guys are clear with that, the nasopharynx, oropharynx, and laryngopharynx. This picture kind of shows, once again, how like water or milk could get up into your nose. If you are starting to laugh while you have milk in your mouth, then as that goes to the back of your throat, because you're about to swallow the milk, and you laugh, that air is expired up and out of the trachea and the larynx, which then pushes the milk up into the narrow nasopharynx, and then it comes out your nose, which is pretty funny. So for the respiratory system, we have the trachea, and that is directly inferior to the larynx. Behind the trachea, or posterior to the trachea, we have your esophagus. Now, the trachea is full of cartilaginous rings to keep it nice and open all the time, so that way you can always have air going in and out. The esophagus is a hollow collapsible tube, meaning that it is just kind of like, I really don't know, it's a collapsible tube. It's smooth muscle, it's really soft, and then it'll kind of like stay flat like this, but then when you eat something, then it's going to kind of open up, and then it's going to have that food travel down. This is what connects the mouth to the stomach. So you go down the esophagus from the mouth to the stomach. We have two sphincters with your esophagus, one at the top and one at the bottom, and this is going to prevent air from going down into your esophagus and possibly getting down into your digestive system. That air can cause a lot of discomfort and eventually a lot of gas, and it can also kind of mess up some of the chemical digestion that's going to happen later on. So we go through the superior sphincter down into the esophagus. The lower sphincter is going to open up, and then that is going to go into the stomach. That is the lower esophageal sphincter, and this is what's responsible for people having heartburn. So before we really dive into the lower portions of the digestive system, I want to talk a little bit more about the stomach and the esophagus with heartburn itself. Hopefully you guys know that the stomach contains a lot of acid, which is that hydrochloric acid, and that is going to be really, really important for the chemical breakdown or the chemical digestion, especially of proteins, which we're going to talk about more later on. So with the stomach, you have a ton of acid in there and a lot of other juices which are going to help with digestion and eventually absorption. But if that lower esophageal sphincter, so if this is the esophagus and this is the lower esophageal sphincter, if that is not really tight, if it's loose and maybe a little bit weaker, then that can allow for some of that hydrochloric acid in your stomach to splash up into your esophagus and actually burn away at the esophageal lining. And that is what causes heartburn. So one of the typical solutions for heartburn is taking an antacid like Tums, and that is just going to neutralize the pH of your stomach. However, your stomach is supposed to be extremely acidic. So if you neutralize the pH of your stomach all the time, if you're constantly chewing Tums, then your stomach is actually going to start producing more acid in order to make sure that the pH is nice and low to keep the digestion of proteins going. So one of the best things you can do is just try not to eat a lot of acidic foods or junk foods. I know that those can kind of trigger a lot of hydrochloric acid to be produced within your stomach. And then just drink a lot of water. Water is neutral in pH, and so that can really assist as well. So within your stomach does stretch, and that is thanks to these little folds called rugae. This is where a lot of mucus is going to be produced in order to make sure that the stomach doesn't actually digest itself. On average, the stomach can hold about a liter of food. However, if you are constantly stretching out your stomach by eating a ton of food all in one sitting, then that can stretch to accommodate even more food. We have several different portions of the stomach itself. We have the body of the stomach up here. This is going to be called the cardiac region. I think it's just because it's closest to the heart in the human. We have the fundus and then the pyloric region, which is eventually going to lead into the small intestine. So just like how the esophagus had two sphincters, one at the top and one at the bottom, in order to make sure that only food was getting down or water getting down during the appropriate time, we have a sphincter at the top here to prevent any of that food from going up into the esophagus. And we also have a sphincter here, it's called the pyloric sphincter, which is going to prevent food from moving on into the small intestine before it is ready. So, next thing I want to talk about with the stomach. When your food mixes with your saliva, we call that a bolus. Once the food goes down into your stomach and mixes with those gastric juices as well as all of that hydrochloric acid, this is now called chyme. Now, your stomach really doesn't do a whole lot of digestion and absorption. It's starting to break down those proteins. We see carbohydrates starting to be broken down by your saliva, but a lot of those fats are not broken down yet, and a majority of your food is not digested yet. So your stomach is kind of just like a glorified purse. It does do a little bit of digestion and a little bit of absorption, but its main purpose is to hold on to food before your small intestine is ready to accept and really start digesting and breaking down all of the food that you just consumed. So while we are looking at the stomach as more of like a holding place for food, it can absorb a little bit of stuff that is already available and small enough to be absorbed. Water can be absorbed within your stomach. Salts can be absorbed within your stomach. Alcohol can be absorbed in your stomach, as well as some lipid-soluble drugs. So we have those four things that can diffuse across the mucosa and submucosa membrane of your stomach. But the larger pieces like food and whatnot, those really aren't going to be digested or absorbed yet. So you're not getting a lot of that nutrient or nutrition then. If you end up vomiting, super uncomfortable, one of the worst experiences ever for me personally. What happens then, because your stomach sits right here, so it's over on the left side of your abdomen. We call that the upper left quadrant of your abdomen. When you vomit, those abdominal muscles are going to contract, which is going to push your stomach up. That lower esophageal sphincter is going to open, and then that is going to eject all of the chyme, the food mixed with the saliva and the gastric juices, up and out of the esophagus and out hopefully into the toilet. You're going to notice that your esophagus is kind of burning. People that suffer from bulimia, which is an eating disorder where people will vomit after they eat in order to control their body weights, they will tend to have erosion on their teeth because of the frequency of that stomach acid up in their mouth. If you do vomit, try not to brush your teeth right away because you will be rubbing the acid on your teeth and helping erode away the crown of your teeth. So one of the best things that you can do for yourself if you do end up vomiting, gargle, gargle, gargle with a ton of water, wash it all out, and then after a while, feel free to go back and brush your teeth because I know it's not pleasant. This is part one of the video. We're going to continue next with the small intestine and large intestine, as well as the liver, pancreas, and looking at those accessory organs. But before you continue, I would go ahead and just pause this video and make sure that you know the answers to all these questions. And here are all the answers. Okay, good job guys, and I'll see you on the next video.